All right. It is so gratifying to see such a big crowd here of people who are so passionate about cancer and finding a solution for it. So before we have our keynote speaker, we wanted to take a few minutes for an announcement. And this is something that we alluded to at our last conference, but we have a lot more information to share with you. And so you may have heard of our Louisiana Cancer Endowment, and I like the way that Chad had described it earlier. So CAGLA is really a two-legged stool, right? We have the advocacy work we do in Baton Rouge to pass new laws, and we have the educational part of the stool, the leg of the stool, which is what you're at right now, the big conference and other educational opportunities. And the Louisiana Cancer Endowment is our third leg. This is our research leg. This is a separate entity, legally a separate entity, a nonprofit that is geared towards cancer research. And we're going to talk about this in a little bit more detail. So and I think I'm preaching to the choir, because I think you guys probably know this than just about anybody, because you see it every day. Cancer in Louisiana is a national crisis. There's no other way of putting it. It is a crisis. Why? Let's see if there we go. We have the third highest incidence rate of cancer in the country. We have the fifth highest mortality rate of cancer in the country. And if you live in Cancer Alley, anywhere between Baton Rouge and New Orleans, you have a 95% higher chance of getting cancer than if you lived anywhere else in the country. In addition to that, our disparities are the worst in the entire developed world, meaning people who have access and who don't have access to treatment. Here's Cancer Alley. This is the epicenter of cancer in the United States, right here, Baton Rouge to New Orleans, the river corridor. Let's see, my slides are moving slow. There we go. And so, we formed CAGLA 8 years ago now, to do something about this, to change the trajectory. And you know what? We've made an impact. And, had we not done anything, we would have been exactly where we were 7 years ago. But we did something. And as Chad mentioned to you before, we formed this coalition of cancer physicians, cancer survivors, and cancer philanthropists who show up every time we ask them. I mentioned earlier that every time I go to one of our scientific advisory board meetings at Copeland Tower, I drive there thinking, is anybody going to show up to this thing? And then within 30 minutes, the room is completely packed, and we've got 50 incredibly passionate physicians who are all ready with their ideas and ready to volunteer and lead committees and help us in any way they can. It's amazing. We're led by one of the hardest working board of trustees anywhere. And of course, this is our group. You've probably seen these faces around today. They're doing all the heavy lifting of preparing the conference, and nobody does any more heavy lifting than Chad. So he is, I don't know how he does it. So he has a pool of energy that just is never exhausted, yeah, which is phenomenal. And this is our scientific advisory board. I hope I didn't forget anybody because it's ever expanding. But these physicians represent every medical specialty that touches cancer. They represent every corner of our state, and they represent every major health system in our state as well. From Our Lady of the Lake to Mary Bird to Willis-Knighton up in North Louisiana, to LSU Shreveport, to UMC in New Orleans, to Truro, Tulane, East Jeff, Ochsner, and the list goes on and on and on. Say Tammany and others, as you can see here. This is an incredible coalition. I've been around for a long time working in medicine in the state of Louisiana, and I've seen time and time again when some of these systems have tried to work together, and when you do it from a top down, it generally doesn't work so well. We've done it from a grassroots. We're starting with the people who take care of the patients every day and going from there. And that has worked, because we all have one goal in mind, is that's to improve the lives of cancer patients in our community. So as I mentioned, CAGLA, two-legged stool, advocacy. We've passed 15 bills into law in the last 5 years. We have a 100% success rate. There is virtually no advocacy group in the country who can claim that. Not one bill that we have brought to the state capitol has not been signed by the governor into law. And of course, education. This is our biggest conference yet, our 5th annual conference. I think we have about just under 1,500 people here. It just grows every year. It's our 3rd venue because we've grown out of the others. And we had to hold our registrations because the fire marshal actually got onto us with this space. So we may have to even look for bigger space in the future. We'll see. But that 3rd leg is the Louisiana Cancer Endowment. Why did we do a cancer endowment, and what is a cancer endowment? If you look at ASCO, ASCO has the Conquer Cancer Foundation. This is a foundation that gives research grants. This is a nonprofit that's associated and affiliated with ASCO. Let's look to the state of Texas. The state of Texas basically has their own NCI. It's called a CPRIT. They have $6 billion that sits in a fund and generates income every year, generates interest, and they use that money to give research dollars to physicians and researchers in the state of Texas. So they don't have to compete for federal funds like other states. And lots of states have this. In Louisiana, prior to LCE, we had exactly $0 set aside for this. But we're changing all that. So we're, as I mentioned, inspired by Texas, inspired by Washington State's Andy Hill Care Fund, and others. If the state's not going to do it, if nobody else is going to do it, we've got to do it. We've got to do it ourselves. And so the physicians, the philanthropists, and the survivors of CAGLA got together and formed this organization. So what will this do exactly? As I mentioned, research grants, seed funding, travel awards for fellows, education, so on and so forth. So what we did is we took some of our senior leaders from CAGLA and we decided to make them part of our leadership for the Louisiana Cancer Endowment. So Chad is the chairman, I'm the executive director, Al is our development officer and director, and Karen Stahl is our secretary and director as well. We also took a component of our scientific advisory board, and these are our peer reviewers. No funds will be doled out through the Louisiana Cancer Endowment without a very specific peer review process. This will all be anonymous and so on and so forth. And, we want to talk a little bit about opportunities and partnership, because we can't do this alone. There's no way we can do this alone. So we had some initial donors, which we appreciate very much. Tempus, the Karen Stahl Breast Cancer Research Institute, the Maudie Cancer Fund, and Kim Grow and the Breast Cancer Recovery Fund all gave us some startup funds to get this off the ground. And then we also have 2 founding gold partners, which we would like to recognize today, and that is Pfizer and AstraZeneca. And what I can tell you is that because of the partnership that we have, and we'll go into it in a few moments, but because of the partnership that we have engendered with this group, with these 2 groups, they have a huge advantage in the market now in the state of Louisiana. They have access that they've never had before. We're doing projects, and in fact, I'll announce now after our keynote speaker at 2 o'clock, it's a closed-door session with Pfizer for any physician or APP who's here that treats prostate cancer. We'd like you to consider coming over to track 4 with a closed session, and we're going to look at some very critical and very sensitive data around treatment patterns of prostate cancer in the state of Louisiana, and we're going to brainstorm on how we can improve these. And so this is the type of work that we're doing together. So first, I'd like to recognize Pfizer. Pfizer has pledged $100,000 initially, with an option of renewing that every year for up to 5 years for a $500,000 pledge. And so I'd like to recognize Pfizer and bring all of the Pfizer folks from who are out here up to the stage. you. Very good. Very good. Thank you all. Thank you all. You want to say a few words?
Yeah.
Okay. I'll do a picture of everybody.
That's right. All right. While everybody's getting on stage, I'm Michael Artman with Pfizer Oncology. I just wanted to say on behalf of my team and also our team at Pfizer Oncology, a sincere thank you to CAGLA and also LCE for their collaboration and also making this partnership come to fruition. We were very honored. We're also very excited to help cancer patients throughout the state of Louisiana, especially in Cancer Alley, which is our huge focus. So again, thanks again for all the hard work we put into this, and looking forward to some great success from this project. Thank you very much.
Let's see if we can get together for a photo. Okay. Let's see. Yeah, how can we do it? I don't want to. Oh yeah, we're here. Okay, maybe we can do it. Maybe why don't we do it after? Want to do it after?
Sure.
Okay, we'll do it after. Okay, yeah. Okay, great. So we really appreciate the support from Pfizer. Now, our next sponsor, our next founding partner, is AstraZeneca. And AstraZeneca pledged $500,000 as well. They gave us $300,000 up front and plan to give $50,000 each year for the next 4 years. And so with these two pledges, we have raised over $1 million for the Louisiana Cancer Endowment in our first year. And so I really appreciate having two folks from AstraZeneca here today, because they are having their national sales meeting out in San Diego. Is it San Diego? And everyone from the entire company is out there. Some of them are coming in tomorrow. They couldn't be here today. But Jim and LJ, who have been an incredible partners and really made this happen, were able to come, and I'd like for them to say a few words as well. Thank you, guys. Thank you.
Well, I will say that the local people stayed back, and I'm a local person from Ponchatoula, Louisiana. So I'm glad to be here. AstraZeneca is all in with the Louisiana Cancer Endowment. It's been a pleasure to work maybe over the last 18 months with Chadwick and Dr. Matrana to really shepherd this through internal logistics at AstraZeneca. And as Dr. Matrana just said, our entire company for oncology is at a meeting right now. And Mohit Manrao, our senior vice president for oncology for AstraZeneca, has pre-recorded a message. So thank you. Thank you.
Oh, yeah. Oh, wait, we can get a photo, please. Oh, good. Thank you. All right, we can go ahead and play that video.
I give a special recognition. On behalf of AstraZeneca, we are honored to be a founding partner of the Louisiana-Cancer Conference. We have a shared vision to eliminate cancer as a cause of death. We are helping ensure sustained investment that pushes oncology research forward, expands access, and improves outcomes for every patient, especially in the communities that have carried a disproportionate burden for far too long. Partnership is how we all would make progress. Together with LCE's physicians, survivors, and applicants, we will help accelerate early detection, advance clinical research in Louisiana, and strengthen equity across the state. We are truly grateful to stand with you and CAGLA at this year's 5th annual conference, and we are committed to turning today's matter into action that process to progress. Thank you so much.
Yeah, thank you. Thank you to AstraZeneca. We really appreciate it. We really appreciate it. All right, we can go back to the slides now. So we are so appreciative of Pfizer and AstraZeneca, and as stated, they're bringing great value to the state of Louisiana, but our physicians and our cancer providers at every level are also bringing great value to these companies because we're doing projects together. We're being kind of used as a sounding board, as a brain trust, and we're really looking forward to what the future holds. There's still room. There's still room for additional partnerships, and we want additional founding partners. We won't have that opportunity open for long, but we do want to open it and extend it. And we hope really that every one of our sponsors, every one of our companies who are here today can work with us in some way to make this dream of a cancer endowment for the state of Louisiana a reality. And we hope that those of you out there from these companies who can bring this up your chain of command will do so. And so here are some of we can work with any company in any way that you see fit, but this is our initial framework. Bronze sponsorship, which would get you recognized as a partner. Attending dinners with our folks would be a $25K annual ask. A silver partnership, which would allow your company to speak at these events, would be a $50K ask. And then for gold, which is what Pfizer and AstraZeneca are, at $100K annually. This is really the full package. So you can do special projects with our teams. We can really make this work in any way that you see fit. But this is really where you get the most value, and this is the $100K annually membership. We also have a platinum membership at a one-time gift of $1 million. So, please bring this up the chain of command. Let this be known to your companies and to your executives. We really appreciate it. You can contact Chad or I to discuss this at any time, and we'll definitely be circling around. I know some of the companies already are working with us to make this a reality, so that next year we just don't have 2 companies to announce, but we have a whole slew of companies to announce as LC partners. So thank you very much, and with that, we're going to change gears a little bit.